Well, now it's time to answer some common medical questions, and joining us is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in today.
Thank you. How are you?
I'm doing well. Always good to see you. Well, we're going to jump right into our first question. One viewer writes, sometimes I get pain from my wrist up to my shoulder. Is this carpal tunnel syndrome, tennis elbow, arthritis, or something else?
Yeah, I mean, not an uncommon complaint. And just as a general rule, if you're having pain in an extremity, for the most part, the origin of etiology is going to be closer to the body, and then it'll extend down from there. Very uncommon for something to start in the hand or the wrist and make its way up to the elbow or to the shoulder. That being said, carpal tunnel, it's inflammation in the wrist. Typically, it's going to cause inflammation right here and pain into the fingers. So unlikely that's going to be the source. Tennis elbow is an injury to the tendon right here on the lateral aspect of the outside of the elbow. That's also a no way. So arthritis, yeah, it's possible. However, that's typically an individual joint, and you're going to have pain in one of the joints, but typically not the entire arm. That being said, what is it? Well, the most common thing that I would think of, and the most common thing that does it, is going to be either a slip disc or a pinched nerve in the neck, which can radiate down the arm. If that's occurring, it can occur without pain in the neck as well. But one of the things I want you to be aware of is that if you're having pain in your arm and you are, say, over 40, 45, or it's associated with chest pain or shortness of breath or even sweatiness, could be your heart trying to tell you something, maybe trying to have a heart attack, make sure you get to the ER immediately. Call 911.
Now, follow-up question to that, though. We've always heard it's the left arm, so this person actually didn't say which arm it was. If it's your right, is that an indication that it's probably just pain in your arm?
Not necessarily.
Oh.
It more commonly, when it comes from the heart, is from the left, but we have seen it on the right. So you never want to just rule it out based on which side the pain is on.
Okay, good to know. Well, here's our next question. What's the best treatment for a bee sting?
Bee stings, very common, coming up this summer, and we've all had it
Don't tell me that. I'm scared of bees.
We've all had it happen once or twice. Matter of fact, I got to tell you this story. It happened to me a couple years ago, about 2 years ago, at a wedding party outside. Bee was swarming around. My friend hit it. It hit me right here. For the rest of the pictures, I had a swollen eye.
Oh, wow.
True story. So anyway, it is a local inflammation. For 98% of us, all it is a redness, a little tenderness, maybe some swelling at the site where you were stung. Not typically a problem. How you would treat that is, first, pull the stinger out. Either with a credit card, you kind of scrape it off, or just pull it out with your fingers. Then you put an ice pack on it. Then, if you have hydrocortisone cream, a little application actually helps with the swelling. If you don't, what you can use is a little water with meat tenderizer or baking soda, make it into a paste, put it on there. Works real well for the pain and the swelling. And then lastly, for the itching, you can use Benadryl. Now, if you have dizziness, nausea, vomiting, diffuse hives all over your body, then that could be a sign of a much more serious allergic reaction. Absolutely call 911. You're probably going to need epinephrine and IV steroids and more powerful medications to tone down that severe allergy. People die from it. Recently had somebody who was stung in the back of the throat and came in. Unfortunately, didn't survive.
And that right there is why I'm so afraid of bees.
Yes.
I feel like I'm going to be that 2% person that's allergic to it.
That's correct.
And find out the hard way.
And you don't know when it's you until, unfortunately, it happens for the first time, yeah.
I do the bee dance, so if you ever see me outside doing this, it's probably a bee somewhere.
We've all done that once or twice.
All right, thank you so much for coming in, Dr. Soria. And, of course, if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, and click on the health link. Scroll down on the right-hand side, and you will see the form to write in your question. All right, so we will see you next week.
You bet. Good to see you.
And again, I always feel so smart when you come in.
Thank you.